The Ayushman Bharat Digital Mission was actually a question that was asked in the 2022 prelims examination as a question as an option 2. The Ayushman Bharat Digital Mission was launched by the Prime Minister through a video conferencing. The nationwide rollout of the project coincides with the National Health Authority (NHA) celebrating the 3rd anniversary of Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. Ayushman Bharat is a flagship scheme of India, which was launched as recommended by the National Health Policy 2017 to achieve the vision of universal health coverage or UHC. It has various aims and purposes, like providing digital health IDs for all Indian citizens to help hospitals, insurance firms, citizens accessing the health records electronically when required. The pilot project of the mission had been announced by the Prime Minister from the ramparts of Red Fort on 15th August 2020. The project is being implemented in the pilot phase in many states and union territories. The health ID will be issued to all citizens of India that will also work as their health account. This health account will contain details of every test, every disease, the doctors visited, the medicines taken and the diagnosis. Health ID is free of cost and voluntary. It will help in doing analysis of health data and lead to better planning, budgeting and implementation of the health programs in India. The major component of the program is creating a Healthcare Professionals Registry or the HPR and Healthcare Facilities Registry or HFR, allowing easy electronic access to medical professionals and health infrastructure. The HPR will be a comprehensive repository of all healthcare professionals involved in delivering healthcare services across both modern and traditional systems of medicine. The HFR database will have records of all the country's health facilities. Ayushman Bharat Digital Mission Sandbox is also created as a part of this mission. It will act as a framework for technology and product testing that will help organizations, including private players, intending to be a part of the national digital ecosystem, become a health information provider or health information user, or efficiently link with building blocks of Ayushman Bharat Digital Mission. The National Health Authority (NHA) under the Ministry of Health and Family Welfare is managing it. What are some of the expected benefits? It is definitely helping to ensure ease of doing business for doctors and hospitals and healthcare service providers. Enable access and exchange of longitudinal health records of citizens with their consent. It can also help in creating integration with the digital health ecosystem, very similar to the role played by the UPI in revolutioning payments. But there are definitely some of the concerns that should be listened. The lack of a data protection bill can lead to a misuse of data by private firms, and thanks to the data protection laws which are going to come, the Ayushman Bharat Digital Mission will be developed by adopting India Enterprise Architecture Framework or India. The design of the building blocks of Ayushman Bharat Digital Mission will adopt and conform to the India by default. All the design and development efforts will adopt the Agile India framework notified by the Ministry of Electronics. Ayushman Bharat Digital Mission will ensure security and privacy by design. A national policy on security of health systems and privacy of personal health records will be developed. Even though there are many aspects, there should be a push drafting at making health a right in India. It's very important. In addition to it, the failure of similar national health service in the United Kingdom must be learned from, and the technical and implementation related deficiencies must be proactively addressed prior to the launching of the mission on a pan-India scale. The standardization architecture across the country will need to find ways to accommodate state-specific rules. It also needs to be in synchronization with government schemes like Ayushman Bharat Yojana and other IT-enabled schemes like reproductive childcare, health and Nikshay, etc.